Hello everyone, Dr. James Carter here. Today, we're going to have a crucial conversation about your heart health, something that truly can't be overstated. Your heart is an incredible organ, beating over 100,000 times every single day, working around the clock to keep you alive and well. But what happens when your heart starts to struggle? Often it tries to send you warning signals, sometimes subtle, sometimes more obvious. Unfortunately, many people ignore these early signs, dismissing them as minor annoyances or simply a normal part of aging. But the truth is, ignoring these symptoms can be extremely dangerous, and in some cases, even life-threatening. Today, I want to walk you through 20 warning signs that your heart could be in trouble. These symptoms might seem harmless at first, like feeling more tired than usual, getting out of breath quickly, or experiencing mild chest discomfort. But each of these can be your body's way of telling you that your heart needs attention. Let's break down each sign, explain what it means, and give you real-life examples so you know exactly what to look out for. First, let's talk about fatigue. If you find yourself feeling unusually tired, even after a full night's sleep, or you're struggling to get through your daily activities, this could be a sign that your heart isn't pumping efficiently. For example, if you used to walk up a flight of stairs with no problem, but now you're winded or need to rest halfway, that's a red flag. Fatigue happens because your heart isn't delivering enough oxygen-rich blood to your muscles and organs, making everything feel like a struggle. Next, let's discuss shortness of breath. Maybe you notice you're out of breath after light activity, or even while resting. This can be a sign of heart failure or blocked arteries. For instance, if you're lying in bed and suddenly feel like you can't catch your breath, or you wake up gasping for air, it's time to take this seriously. Your heart may not be able to keep up with your body's demands, causing fluid to build up in your lungs. Chest discomfort is another major warning sign. This doesn't always mean sharp pain. Sometimes it's a feeling of pressure, squeezing, fullness, or even burning. It might come and go, or it might last for several minutes. Some people describe it as a heavy weight on their chest. If you ever feel this, especially if it spreads to your arms, neck, jaw, or back, seek medical help immediately. This could be a sign of a heart attack or angina. Other signs include swelling in your legs, ankles, or feet, known as edema. This happens when your heart can't pump blood effectively, causing fluid to build up in your lower extremities. You might notice your shoes feel tighter, or you have to loosen your socks. Pay attention to sudden or unexplained swelling. Irregular heartbeat, or palpitations, is another symptom to watch for. If your heart feels like it's racing, fluttering, or skipping beats, especially when you're at rest, this could indicate an arrhythmia or other heart condition. Dizziness, fainting, or feeling lightheaded can also be signs that your heart isn't pumping enough blood to your brain. Cold sweats, nausea, or sudden feelings of anxiety can also be linked to heart problems, especially if they occur with other symptoms. Some people, especially women, may experience these instead of classic chest pain during a heart attack. Pain in your neck, jaw, throat, upper abdomen, or back can also be a warning sign, particularly if it comes on suddenly or is accompanied by other symptoms. Don't ignore these unusual pains. If you notice any of these symptoms, whether it's fatigue, shortness of breath, chest discomfort, swelling, palpitations, dizziness, or unexplained pain, don't brush them off. Early detection is key. Getting checked by your doctor can lead to early treatment, lifestyle changes, and potentially prevent a heart attack or other serious complications. Remember, your heart is the powerhouse of your body, and it deserves your attention. If you notice any of these warning signs, reach out to your healthcare provider. Even if you think it's nothing, a quick checkup can give you peace of mind or catch a problem before it gets worse. Now, let's dive deeper into each of the 20 signs your heart is crying out for help. Stay tuned, take notes, and remember, listening to your body could save your life. Chest pain is widely recognized as the classic sign of heart trouble, and it's one of the most critical symptoms you should never ignore. When most people picture a heart attack, chest pain is usually the first warning sign that comes to mind. However, what many don't realize is that chest pain related to heart problems can present in a variety of ways, and not all of them are dramatic or severe. Sometimes it's a sudden crushing pain that feels like an elephant is sitting on your chest, stopping you in your tracks, and making it impossible to ignore. Other times, it's a mild, nagging discomfort that you might be tempted to brush off as something insignificant. Chest pain associated with heart problems can feel like pressure, squeezing, fullness, or pain in the center of your chest. Some people describe it as a heavy weight pressing down, while others say it feels like a tight band or even a burning sensation similar to heartburn. The pain can last for several minutes, or it may come and go in waves. It might even radiate to other parts of your body, such as your shoulders, arms, neck, jaw, or back, making it easy to mistake for something else entirely. For example, some people experience pain that travels down the left arm, while others might feel discomfort in the upper back or jaw. These variations can make it challenging to recognize the true cause, especially if you've never experienced heart-related symptoms before. Even mild discomfort that comes and goes can be a warning sign of a heart problem. Don't ignore it just because it isn't severe, or because it doesn't match the dramatic heart attack scenes you've seen in movies. Sometimes the pain is so subtle that people think it's just heartburn, indigestion, or muscle strain from physical activity. For instance, you might feel a dull ache after carrying groceries or a slight burning sensation after a stressful day. But if you notice any unusual sensation in your chest, especially if it's new, different, or unexplained, it's important to pay close attention. Heart-related chest pain can be triggered by physical exertion, emotional stress, or even occur at rest, and it may be accompanied by other symptoms like shortness of breath or fatigue. It's common for people to brush off chest pain as indigestion, anxiety, or stress, especially if it happens during a busy day or after a meal. Many people make the mistake of thinking their symptoms are caused by something minor, like a pulled muscle or emotional tension. But if your chest pain is triggered by physical activity, such as climbing stairs or carrying heavy objects, or by emotional stress and then eases when you rest, that's a classic warning sign of heart disease, known as angina. Angina is your heart's way of telling you it's not getting enough oxygen-rich blood. Ignoring these symptoms can be dangerous, as they may be a precursor to a heart attack. Always take these symptoms seriously, even if they seem mild or go away with rest. If chest pain lasts more than a few minutes, or if it's accompanied by other symptoms like shortness of breath, sweating, nausea, vomiting, or lightheadedness, call 911 immediately. Don't try to drive yourself to the hospital or wait to see if the pain goes away. Quick action is crucial. Every minute that passes without treatment increases the risk of permanent heart damage or even death. For example, studies show that people who seek help within the first hour of symptoms have a much higher chance of survival and recovery. Paramedics are trained to provide life-saving care on the way to the hospital, and emergency rooms are equipped to quickly diagnose and treat heart attacks. Remember, time is muscle. Every minute counts when it comes to your heart. The longer you wait, the more heart muscle can be damaged, which can lead to long-term complications like heart failure or arrhythmias. Getting help fast can save your life and prevent lasting damage. If you or someone you know experiences chest pain, no matter how mild or ambiguous, don't hesitate. Trust your instincts, act quickly, and get the emergency care you need. It's always better to be safe and get checked out, even if it turns out to be something less serious. Your heart is too important to take chances with. Have you ever found yourself gasping for air after climbing just a few steps, or needing to pause and catch your breath during simple activities like walking to the mailbox or carrying groceries? Shortness of breath, especially when it happens with minimal effort, is your body's urgent way of telling you that something isn't right. This isn't just about being out of shape or getting older. It's a major red flag that your heart may be struggling to deliver enough oxygen-rich blood to your body. When your heart can't pump efficiently, your muscles and organs don't get the oxygen they need. This can leave you feeling breathless, even when you're sitting still or lying down. For example, people with heart failure often describe waking up at night, gasping for air, or needing to prop themselves up with pillows just to breathe comfortably. This symptom can be a sign of serious conditions like heart failure, where the heart's pumping ability is weakened, or a blocked artery, which restricts blood flow and oxygen delivery. In some cases, shortness of breath may be the very first warning sign of a heart attack or a dangerous arrhythmia. Don't ignore this symptom, or assume it's just due to aging or lack of fitness. Persistent or unexplained shortness of breath always deserves a conversation with your doctor. Early evaluation can help identify underlying heart problems before they become life-threatening. Remember, Early intervention can make a world of difference. If you or someone you love is experiencing ongoing shortness of breath, don't wait. Get checked out and give your heart the care it needs. We all feel tired from time to time, but if you find yourself constantly exhausted, even after a full night's rest, this could be a warning sign that your heart isn't functioning properly. Relentless fatigue is more than just feeling sleepy. It's a deep, persistent exhaustion that doesn't go away with rest or caffeine. When your heart struggles to pump enough oxygen-rich blood to your organs and muscles, your body simply can't perform at its best. This can leave you feeling weak, drained, and unable to complete even simple daily tasks. For example, you might notice you're out of breath after climbing a single flight of stairs, or you need to take frequent breaks while doing chores that used to be easy. This isn't the kind of tiredness that improves with a nap or a weekend of extra sleep. It's a profound, unrelenting exhaustion that can affect your ability to concentrate at work, enjoy time with family, or even get through a normal day. People often describe it as feeling like they're running on empty, no matter what they do. If you notice that your fatigue is accompanied by other symptoms, such as shortness of breath, chest discomfort, or swelling in your legs and ankles, it's especially important to pay attention. These could be signs of heart failure or other serious heart conditions. Don't ignore persistent tiredness, especially if it's interfering with your daily life. Instead of pushing through, reach out to your healthcare provider. They can run tests to check your heart's function and help determine if your fatigue is related to a heart problem or another underlying health issue. Early detection and treatment can make a significant difference in your quality of life and long-term health. Have you ever noticed swelling in your legs, ankles, or feet, especially at the end of the day or after sitting for long periods? This swelling, known medically as edema, is more than just a minor inconvenience. It can be a subtle but important warning sign that your heart isn't working as efficiently as it should. Edema happens when excess fluid gets trapped in your body's tissues, most commonly in the lower extremities. When your heart struggles to pump blood effectively, pressure builds up in the veins of your legs and feet. This pressure forces fluid out of the blood vessels and into the surrounding tissues, leading to noticeable puffiness and swelling. For example, you might see your ankles or feet looking unusually puffy, or you may notice that your skin appears stretched and shiny. Sometimes, pressing a finger into the swollen area leaves a dent that takes a while to disappear, a classic sign called pitting edema. This is a direct result of fluid accumulation due to poor circulation. You might also find that your shoes suddenly feel tight, or that your socks leave deep marks around your ankles. These early clues are easy to overlook, but they can be the first signs that your heart is under strain. While swelling in the legs and feet can have other causes, such as standing for long periods, pregnancy, certain medications, or kidney and liver problems, heart failure remains one of the most serious reasons. In heart failure, the heart's weakened pumping action leads to a backup of blood and fluid, especially in the lower body. If you notice new or worsening swelling, especially if it's accompanied by other symptoms like shortness of breath, fatigue, or rapid weight gain, it's crucial to seek medical advice promptly. Early detection and treatment can make a significant difference in managing heart-related conditions and preventing complications. Don't ignore these hidden signals. Your heart may be trying to tell you something important. Have you ever felt your heart suddenly flutter, pound, or even seem to stop for a split second before resuming its rhythm? These sensations, sometimes described as palpitations, can be startling, and they're more common than you might think. Many people notice their heart skipping a beat while resting, lying in bed, or after a stressful moment. While occasional irregular heartbeats can be harmless, often triggered by caffeine, anxiety, or lack of sleep, frequent or persistent irregular rhythms, known as arrhythmias, deserve careful attention. These can be a sign that your heart's electrical system isn't working properly. Arrhythmias come in many forms. Your heart may beat too fast, a condition called tachycardia, too slow, known as bradycardia, or in a completely erratic pattern such as atrial fibrillation. For example, atrial fibrillation is a common arrhythmia that increases the risk of stroke and heart failure, especially in older adults. Symptoms can vary widely. Some people feel a racing or pounding in their chest, while others may experience dizziness, lightheadedness, shortness of breath, or even fainting spells. In severe cases, arrhythmias can cause chest pain or sudden loss of consciousness, which are medical emergencies. Some arrhythmias, like occasional premature beats, are harmless and may not require treatment. However, others, such as ventricular fibrillation or sustained atrial fibrillation, can be life-threatening if left untreated. Diagnosis often involves an EKG, Holter monitor, or even an event recorder to capture irregularities over time. If you're experiencing irregular heartbeats, especially when accompanied by symptoms like chest pain, fainting, or shortness of breath, it's crucial to seek medical advice promptly. Early detection and treatment can prevent complications and help you maintain a healthy heart rhythm. Don't ignore these warning signs. Your heart's rhythm is telling you something important. Dizziness or lightheadedness is a warning sign that your brain may not be receiving enough blood and oxygen. This can happen suddenly or develop gradually, and it's often a sign that your heart isn't pumping efficiently. When your heart struggles to circulate blood, your brain is one of the first organs to feel the effects, leading to sensations of unsteadiness, spinning, or even near fainting. The intensity of dizziness can vary. For some, it's a mild, fleeting sensation, like standing up too quickly and feeling a bit off balance. For others, it can be so severe that they feel as if the room is spinning, or they might even lose consciousness. These episodes can last just a few seconds or persist for much longer, making everyday activities dangerous. There are several heart-related causes for dizziness. Poor heart function, such as in heart failure, means the heart can't pump enough blood to meet your body's needs. Arrhythmias, irregular heartbeats, can cause sudden drops in blood flow, leading to abrupt dizziness or fainting. Blood pressure problems like orthostatic hypotension can also make you feel lightheaded when you stand up or change positions quickly. Even medications for heart conditions can sometimes contribute to these symptoms. It's important to pay attention to how often you experience dizziness or lightheadedness, and under what circumstances. If these episodes are frequent, unexplained, or accompanied by fainting, chest pain, shortness of breath, or palpitations, you should contact your doctor right away. These could be signs of a serious underlying heart problem that needs prompt evaluation. Don't ignore these symptoms or try to push through them. Dizziness can lead to dangerous falls, injuries, or even signal a life-threatening heart event. Getting a proper diagnosis and treatment can help prevent complications and keep your heart and your brain safe. Most people think of a cough as a simple symptom of a cold or allergies, but when a cough just won't go away, especially if it lingers for weeks or even months, it could be a warning sign that your heart is in trouble. Pay close attention if your cough produces white or pink, frothy mucus. This isn't just a random occurrence, it can be a sign that your heart isn't pumping blood efficiently. When the heart's left side struggles to pump blood, fluid can back up into the lungs, a condition known as pulmonary edema. This fluid buildup irritates the airways, triggering a persistent cough. The frothy, sometimes pink-tinged mucus is caused by blood leaking into the lungs, which is a classic sign of heart failure. This is very different from the dry cough you might get with a cold or the thick yellow mucus of a chest infection. If your cough is accompanied by other symptoms, like swelling in your ankles or legs, shortness of breath, or needing to sleep propped up on extra pillows, these are red flags that your heart may be struggling. For example, some people notice they wake up at night gasping for air, or they feel unusually tired after mild activity. These symptoms combined with a persistent cough should never be ignored. If you notice a cough that won't go away, especially with these warning signs, it's crucial to see your doctor as soon as possible. Early detection and treatment can make a huge difference in managing heart-related conditions. Remember, your heart may be sending you a message. Don't ignore it. Most people associate heart problems with chest pain or shortness of breath, but did you know that your heart and your stomach are more connected than you might think? In fact, your digestive system can be one of the first places to show signs that your heart isn't functioning properly. When your heart struggles to pump blood efficiently, it can disrupt the normal flow of oxygen-rich blood to your stomach and intestines. This reduced blood flow can cause a variety of digestive symptoms, including nausea, bloating, and even a sudden loss of appetite. These symptoms can be subtle, but they're important to recognize, especially if you have other risk factors for heart disease. For example, you might notice that you're suddenly not interested in food, or you feel full after just a few bites, even if you haven't eaten much. This isn't just about losing your appetite for a day or two. It can be a persistent feeling that makes you push away your favorite meals, or even feel repulsed by the thought of eating. Some people describe it as a sense of heaviness or discomfort in the stomach, while others might feel queasy or slightly nauseous throughout the day. These changes can be confusing, especially if you're someone who usually enjoys food and has a healthy appetite, but it's important to realize that your body could be sending you a warning sign that something isn't right with your heart. Let's break down why this happens. When the heart can't pump enough blood, the body prioritizes sending blood to vital organs like the brain and heart itself, sometimes at the expense of the digestive system. This means your stomach and intestines may not get the oxygen and nutrients they need to function properly, leading to symptoms like nausea, bloating, or feeling full quickly. These digestive issues are especially common in people with heart failure, but they can also occur in those with coronary artery disease or after a heart attack. In women, these symptoms are sometimes more prominent than the classic crushing chest pain, making them easy to overlook or misinterpret as a simple stomach bug, indigestion, or even stress. It's also important to pay attention to other symptoms that might accompany these digestive changes. For instance, if you're feeling unusually tired, experiencing shortness of breath, or noticing mild chest discomfort along with nausea or loss of appetite, these could all be interconnected signs of heart trouble. People with risk factors like high blood pressure, diabetes, high cholesterol, or a family history of heart disease should be especially vigilant. For example, an elderly person with diabetes who suddenly loses interest in food and feels nauseous for several days should not ignore these symptoms. They could be early warning signs of a heart attack or worsening heart failure. If you notice ongoing nausea, a sudden loss of appetite, or feeling full much sooner than usual, especially if these symptoms last for more than a few days or are accompanied by other warning signs, don't brush them off. Make an appointment with your healthcare provider to discuss your symptoms and get a thorough evaluation. Early detection and treatment of heart problems can make a significant difference in your long-term health and quality of life. Remember, your body often gives you subtle clues when something is wrong. Listening to these signals and acting early can help protect your heart and prevent more serious complications down the road. When most people think of heart pain, they imagine a sharp or crushing sensation in the chest. But did you know that heart pain can actually show up in some unexpected places? This is called referred pain, and it means that discomfort from your heart can travel to other parts of your body, sometimes making it difficult to recognize a heart problem right away. For example, pain can radiate to your neck, jaw, back, or even your arms. This happens because the nerves that carry pain signals from your heart also connect to these other areas, so your brain can get confused about where the pain is actually coming from. This type of referred pain is especially common in women, who are more likely than men to experience heart attack symptoms that don't involve the chest at all. In fact, studies show that women often report pain in the jaw, neck, or back as their main symptom during a heart attack, which can lead to dangerous delays in getting help. Because these symptoms can easily be mistaken for muscle strain, dental problems, or even stress, many people ignore them or treat them with home remedies. But if the pain is unusual, severe, or comes on suddenly, especially if you have risk factors for heart disease, it's important to take it seriously. Pay close attention if pain in your neck, jaw, or back occurs during physical activity, emotional stress, or after eating a heavy meal. These are times when your heart is working harder, and pain triggered by these activities could be a warning sign that your heart isn't getting enough oxygen. In some cases, this pain can be the only sign of a heart attack, especially in older adults and people with diabetes, who may not feel classic chest pain at all. If you notice these symptoms, especially if they come on suddenly or are accompanied by sweating, nausea, or shortness of breath, seek emergency medical attention right away. Don't brush off unexplained pain in your neck, jaw, or back, especially if it's new, severe, or doesn't go away with rest. Trust your instincts and err on the side of caution. If you have other risk factors like high blood pressure, diabetes, smoking, or a family history of heart disease, it's even more important to get checked out by a healthcare professional. Early detection can save your life, so never ignore the surprising warning signs your heart may be in trouble. Sweating is a normal response to heat, exercise, or even stress, but when you suddenly break out in a cold sweat for no obvious reason, especially when you're not physically active or in a hot environment, it can be a major warning sign that your heart is in trouble. During a heart attack, your body goes into crisis mode. It releases a surge of stress hormones like adrenaline, which can cause your sweat glands to go into overdrive. This results in sudden, unexplained sweating, often described as a cold, clammy sweat. Unlike the sweat you get from a workout, this type of sweating can happen while you're sitting still, resting, or even sleeping. This abnormal sweating is often accompanied by other symptoms such as chest pain or discomfort, nausea, lightheadedness, or shortness of breath. For example, you might feel a heavy pressure or squeezing sensation in your chest, Or you could experience pain radiating to your arm, neck, or jaw. Some people, especially women, may notice more subtle symptoms like stomach pain, fatigue, or even just a sense of unease along with sweating. If you suddenly break out in a cold sweat, especially if it's paired with chest pain, nausea, or difficulty breathing, don't ignore it. These could be the early signs of a heart attack or another serious heart problem. Call emergency services immediately. Quick action can save your life or the life of someone you love. Remember, your body is trying to tell you something important. Unexplained sweating is not just about being nervous or overheated. It can be your heart's way of signaling distress. Always take these symptoms seriously, and never hesitate to seek medical attention if you're concerned. Imagine stepping on the scale one morning and noticing you've gained several pounds, seemingly overnight. While it's normal for weight to fluctuate slightly from day to day, a rapid, unexplained increase of 3 or more pounds in just a few days can be a red flag for your heart health. This isn't about gaining fat from overeating or lack of exercise. Instead, it often points to something much more serious happening inside your body. This rapid weight gain is usually caused by fluid retention, not fat. When your heart isn't pumping efficiently, blood can back up in your veins, causing fluid to leak into surrounding tissues. This condition, known as edema, most commonly affects your lower legs, ankles, and feet, but it can also show up in your abdomen or even your hands. You might notice your clothes suddenly feel tighter, rings become difficult to remove, or your shoes no longer fit comfortably by the end of the day. Sometimes, pressing on the swollen area leaves a noticeable indentation, a sign called pitting edema. These changes can be subtle at first, but they're important clues that your body is holding on to excess fluid. If you notice sudden changes on the scale, especially if you haven't changed your diet or activity level, it's crucial to reach out to your doctor. Rapid weight gain can be an early warning sign of heart failure or worsening heart disease. Your doctor may ask about other symptoms such as shortness of breath, fatigue, or swelling to help determine the cause. Monitoring your weight every day, ideally at the same time each morning, can help you and your healthcare team catch early signs of heart failure before they become severe. If you notice a sudden increase, don't ignore it. Early intervention can make a significant difference in managing your heart health and preventing complications. Have you ever found yourself struggling to fall asleep at night, especially when you lie flat on your back? For many people, difficulty sleeping isn't just about stress or insomnia. It can actually be a warning sign that your heart isn't working as well as it should. If you notice that you're suddenly unable to get comfortable in bed, or you wake up gasping for air, it's time to pay attention. When your heart can't pump blood efficiently, fluid can start to back up into your lungs, a condition known as pulmonary congestion. This makes it much harder to breathe when you're lying down, because gravity no longer helps keep fluid out of your lungs. Doctors often see this in patients with heart failure, and it's one of the most common reasons people end up in the hospital for heart problems. To cope, you might find yourself stacking extra pillows behind your back, or even sleeping upright in a chair just to get some rest. This is called orthopnea, and it's a classic symptom of heart-related fluid buildup. Some people may not even realize they're doing it, they just know they sleep better when they're propped up. Another red flag is waking up suddenly in the middle of the night, short of breath, or even gasping for air. This is called paroxysmal nocturnal dyspnea, and it can be frightening. You might also notice you're tossing and turning, unable to find a comfortable position, or waking up feeling exhausted even after a full night in bed. These are all signs that your heart may be struggling to keep up with your body's needs. If you're experiencing new or worsening sleep problems, especially if you need to sleep sitting up, or you wake up breathless, it's crucial not to ignore these symptoms. Talk to your doctor as soon as possible. Early treatment can help manage heart failure, improve your sleep, and protect your long-term health. Remember, your body is trying to tell you something important. Don't wait until it's an emergency. Many people experience heartburn or indigestion after a heavy meal, especially when eating spicy or fatty foods. But did you know that these symptoms can sometimes be mistaken for a heart attack? The burning sensation in your chest, discomfort in your upper abdomen, or even nausea can all overlap with the warning signs of heart trouble. If your indigestion doesn't improve with over-the-counter antacids, or if it seems to come on during physical activity and eases when you rest, this could be a red flag that your heart, not your stomach, is the real culprit. For example, some people notice chest discomfort or a burning feeling after climbing stairs or walking briskly, which goes away when they sit down. This pattern is classic for angina, a symptom of reduced blood flow to the heart. Women, in particular, are more likely to experience these subtle and atypical signs of heart disease. Instead of the crushing chest pain often depicted in movies, women may feel mild indigestion, pressure, or even just a sense of unease. These symptoms can be easily dismissed as stress or a minor stomach issue, but they may actually signal a heart problem, persistent or severe indigestion, especially if it's new, unexplained, or accompanied by other symptoms like shortness of breath, sweating, or pain radiating to your arm or jaw. Should never be ignored. If you find yourself reaching for antacids more often, or if your symptoms don't match your usual pattern, it's important to get checked out by a healthcare provider. Early detection can make all the difference when it comes to heart health. Persistent weakness is more than just feeling tired after a late night or a busy week. It's a deep, ongoing sense of fatigue that doesn't go away with rest or a good night's sleep. Many people brush it off, blaming stress or age, but when your body feels constantly drained, it could be a warning sign that your heart isn't pumping blood as efficiently as it should. When your heart circulation is compromised, your muscles and organs don't receive enough oxygen and nutrients. This can leave you feeling weak, lightheaded, or even dizzy throughout the day. Over time, poor blood flow can make it difficult for your body to recover from even minor exertion, and you may notice that your stamina is much lower than it used to be. Everyday activities, like carrying groceries, climbing stairs, or even walking short distances, can suddenly feel overwhelming. You might find yourself needing frequent breaks or feeling out of breath much sooner than before. This isn't just normal aging. It's your body's way of signaling that something deeper may be wrong. If you notice that your weakness doesn't improve with rest, or if it's accompanied by other symptoms like shortness of breath, chest discomfort, or swelling in your legs, it's crucial to consult your doctor. Persistent fatigue can be a sign of heart failure, anemia, or other serious conditions that require prompt attention and treatment. Remember, it's always better to be proactive about your health. Early detection and intervention can make a significant difference in managing heart problems and improving your quality of life. Don't ignore persistent weakness. Listen to your body, and seek medical advice if you're concerned. Fainting, medically known as syncope, is a sudden and temporary loss of consciousness that can be alarming both for the person experiencing it and for those around them. While fainting can sometimes be caused by dehydration, standing up too quickly, or even emotional distress, it is often linked to underlying heart rhythm problems that should not be ignored. When your heart is unable to pump enough blood to your brain, even for a few seconds, you can lose consciousness. This happens because the brain is extremely sensitive to changes in blood flow and oxygen supply. If the heart's rhythm becomes irregular, beating too fast, too slow, or erratically, it may not be able to maintain adequate circulation, leading to a sudden blackout. Common heart-related causes of fainting include arrhythmias, such as atrial fibrillation or ventricular tachycardia, which disrupt the normal electrical signals in the heart. Valve problems, like aortic stenosis, can also restrict blood flow, especially during physical activity. Severe drops in blood pressure, known as hypotension, may occur when standing up quickly or as a side effect of certain medications, and can also trigger fainting episodes. It's important to pay attention to any warning signs that may precede fainting, such as dizziness, lightheadedness, nausea, or blurred vision. If you've fainted, or even felt like you were about to, make an appointment with your doctor as soon as possible. Be prepared to describe the circumstances, how you felt before and after, and any other symptoms you noticed. Don't wait for it to happen again. Fainting can be a warning sign of a serious heart condition that requires prompt evaluation. Your doctor may recommend tests, such as an electrocardiogram, echocardiogram, or even a heart monitor to determine the cause. Early diagnosis and treatment can help prevent future episodes and protect your heart health. Blue or purple discoloration of the lips, fingertips, or toes, known medically as cyanosis, is a clear warning sign that your blood isn't carrying enough oxygen to your tissues. This happens when the oxygen levels in your blood drop below normal, causing the skin and mucous membranes to take on a bluish or purplish hue. Cyanosis can be subtle at first, often appearing as a slight bluish tint on the lips or under the fingernails, but it can quickly become more pronounced, especially in cold weather or during physical activity. When your heart is unable to pump oxygen-rich blood efficiently, your extremities, like your fingers, toes, and lips, are often the first places to show signs of trouble. This is because these areas are farthest from your heart and are more sensitive to changes in blood oxygen levels. For example, people with heart failure, congenital heart defects, or severe lung disease may develop cyanosis as their condition worsens. Even something as simple as climbing stairs or walking briskly can trigger this discoloration if your heart isn't working properly. Persistent or sudden onset of blue or purple skin, especially if it's accompanied by shortness of breath, chest pain, confusion, or rapid heartbeat, is a medical emergency. These symptoms suggest that your body is not getting the oxygen it desperately needs, and immediate medical attention is required. In some cases, cyanosis can develop gradually, making it easy to overlook until it becomes severe. That's why it's important to pay attention to any changes in your skin color, especially if you have a history of heart or lung problems. Your body relies on a steady supply of oxygen to function, and your heart plays a crucial role in delivering that oxygen to every cell. When your heart is struggling, your body sends out visible signals like cyanosis to alert you that something's wrong. If you or someone you know develops blue or purple skin, don't ignore it. Seek medical help right away. Early intervention can make a life-saving difference. High blood pressure, or hypertension, is often called the silent killer because it typically develops without any obvious symptoms. Many people may have dangerously high blood pressure for years without knowing it, quietly damaging their heart, blood vessels, kidneys, and brain. Over time, this constant pressure can lead to life-threatening complications such as heart attacks, strokes, heart failure, kidney disease, and even vision loss. For example, someone might feel perfectly healthy, yet their arteries are slowly becoming stiffer and narrower, making it harder for the heart to pump blood. This extra strain can eventually cause the heart muscle to weaken or thicken, increasing the risk of heart failure. In some cases, the first sign of high blood pressure is a major event like a stroke or heart attack. That's why regular blood pressure checks are so important, especially if you have risk factors like obesity, a family history of hypertension, smoking, excessive salt intake, or a sedentary lifestyle. If you're diagnosed with high blood pressure, your doctor may recommend lifestyle changes such as eating a balanced, low-sodium diet, exercising regularly, managing stress, and, if necessary, taking medication. Remember, controlling your blood pressure is one of the most effective ways to protect your heart and overall health. Don't let this silent threat go unnoticed. Get your blood pressure checked regularly and